Good day. I am Abigail Armagansha, first-year nursing student from Davao Doctors College. Today, we are going to demonstrate the procedure called assessing respiration. We are going to do an assessment which is to assess the respiration per minute and the possible nursing diagnosis, which is first, fast irregular respirations and second, slow irregular respirations. We also have materials that are needed. We have the alcohol and also the watch. Before we can proceed with the procedure, we have to perform a hand hygiene. Put a lot of alcohol in your hand. Rub your hands and make sure your hands will be clean. Let's start with the procedure number 1.
Procedure number 1. While your fingers are still in place, for the pulse measurement after counting the pulse rate, observe the patient's respirations. To count the RPM of the patient without voluntarily breathing. So, you wouldn't tell your patient that you're counting their breathing because they will alter it or change the way they breathe.
Procedure number 2. Note the rise and fall of the patient's chest just by looking at their chest. So do it on this side so it wouldn't be uncomfortable.
For the third procedure, what you're going to do is check your watch and make sure to count for 30 seconds before starting to count the respiratory rate. Now you check the pulse and look at your watch and start counting for 30 seconds. Then when you're done, you have to multiply it by 2 and that's going to be the result.
We got 14 breaths, which is the normal breath of a patient. So the normal breath of a patient goes to 12 to 14 breaths per minute.
That is for the procedure number 4.
Procedure number 5. If respirations are abnormal in any way, count the respirations for at least 1 full minute. This is to count the respiration cycle for a minute and to assess the patient if it is irregular. But if the patient has regular breathing, we will note the depth and rhythm of the respirations for further assessment of the patient, like on how a patient rises her chest or lowers her chest.
For procedure number 6, when measurement is completed, let's perform hand hygiene, or we can wash our hands with soap and water, or we can use alcohol. After that, we help the patient to put him down on a position where he lies down in the bed and to ensure that the comfort of the patient is prioritized. That's all for procedure.